loved Alex's presentation and obviously his input from a clinician side. My case is very different from a patient side who is not a doctor. So my background was in business and management. I worked in finance for 9 years. And basically I went through this journey while being, in that ecosystem. And I found it extremely hard. So basically, I was so obsessed about this that I decided to study nutrition science, and Sanno was a result after that. I just wanted here to reflect basically the history of my background and where I come from. But essentially, so basically, my presentation is obviously about how important it is to listen to all the actors in the ecosystem since very early on. And obviously, we're going to talk about gut health, gastrointestinal disorders, because it's the space where I'm focused on. But I mean, just as an introduction, the prevalence of gut disorders is really high. And actually, on average, in a Western society, 2 in 5 people that you know struggle with chronic gut disorders. So imagine, I'm sure family or friends who have irritable bowel syndrome, inflammatory bowel disease, celiac disease, any other. There's a long list. And yet, this patient journey, this patient story I told you, it's still not resolved. There's such a big problem affecting a lot of people. But obviously, when we zoom in on what is it exactly the problem out there, is that it's an extremely fragmented pathway, but there's a huge backlog. It's inefficient. And why? I mean, triage, first of all, is pretty much manual based on a 10-minute primary care consultation and questionnaires. Then patient backlog is just increasing. We are seeing crazy waiting times to get to see a specialist. If the patient gets a referral, that can be 9 months. On some trusts is over a year. Also to see your tests done. And obviously this has a major impact on the patient with a delayed diagnosis, which is impacting obviously the person's life significantly. So basically, I'm going to tell you now what we are still building with Sanno and how we brought in the stakeholders since very early on in our journey. Just to give you a very brief overview, I'm not here to talk about Sanno specifically, but we are a patient-facing app to help patients with gastrointestinal disorders. And also, we integrate with the healthcare ecosystem, which is essential. Again, bring in all the actors, right, together. So we connect with the ecosystem, with the NHS and private clinics to essentially help them monitor and manage and treat this patient remotely, outpatient, out of the hospital. But anyway, let's go back to this journey and the stakeholders. So in our case, and many health tech startups pretty much have the same, you have the patient, obviously, very important actor. But obviously you have different parts. You have the GP, primary care. So this patient can go to primary care or can self-manage through over-the-counter and medication. But if the person continues a journey on GP, can go secondary care, testing is also involved. So as you can see, there are many actors already on the game. But there's something really important, which is regulation. What do you need to do in order to integrate and work with these other stakeholders? And ultimately, obviously, the end user, the patient. I mean, in health tech, I think it's extremely hard to build products in health tech because you need to think about regulation since day one. And even if you start direct to consumer with something more wellness type, it's a big responsibility. It's health. So since very early on, we started to read about, okay, what is the medical device regulation, MDD, in the UK? How does it work in other markets like the US? Because obviously every country is driven by its own regulation. So it's very important to check the guidelines that apply and the changes. It's an ongoing ecosystem. But also specialists, talk to a lot of people, consultants who understand very, very well if you're class 1 or if you're eligible for class 2A or what is exactly. I mean, University of Oxford has developed a great tool, by the way, to assess your medical device type. And it's very, very useful. But essentially talk to as many people as possible, and founders also who went through this to learn from the experience, and involve them very early on. I mean, obviously something that Alex said earlier is, what is the problem you're exactly solving? I mean, for us, in order to help people with gastrointestinal problems who don't manage to get a referral or live in pain, trying to figure out what is exactly what we need to do. And for that, we started to talk to not only the patient, but having interviews with the GP, doctor, with dietitians, community dietitians, with secondary care gastroenterologists, with testing providers, stool testing, biomarkers, everything, but also pharma, to understand how they see the problem and at what phase in the journey, etc. With that, we started to really understand how we can build something that addresses the problem and tackles basically the ecosystem as a whole, which is very complex. So first of all, also start getting support from stakeholders. And I mean, for us, it was very, very important to get to accelerator programs in health tech to really help us get closer, for example, to the NHS in the UK. I mean, the Hill obviously is very well represented today here, and we went through the program. It was amazing because we really, I mean, imagine me, as I'm not a doctor. It was really, really challenging to get to the network and get dialogue starting. So this was a great platform for us to essentially get the conversations going. By the way, actually, if you apply for the Hill, the applications are open, I think, until the end of the month, just saying. But get help, and also don't be embarrassed to ask for help. Get feedback. So essentially, when we built our first prototype, the app was so embarrassing, and essentially, I was very ashamed to share that with patients, but it was the best way to go because we got amazing feedback. And ultimately, we found that all the educational science-based programs that we had prepared on the app helped the patients, and they're willing to pay for it. That was a start, right? So get feedback very early on from your patient, but also to all this chain, and iterate fast, very important as well. So once you know what is the problem you're solving, you get people excited about it, who are willing to pay for it. Exactly, sell, but who are the payers? I mean, we spoke earlier, right, about different business models. Is essential because this has to be sustainable over time. The payers is a big challenge in healthcare. Who's going to pay for it? Is it the insurer, or is it commissioned through the NHS? Is it directly from the patient? Is it in the value chain, different stakeholders? So figure that out and test it the earliest, the better. And once you have a clear understanding of that, start building a roadmap, because building a health tech product is really hard. You need to go through different stages. As we spoke about regulation, as we spoke about different features, the different stakeholders, how you connect all that through the tech. So you can start small and focused, but then build and essentially iterate fast, but have always a clear roadmap as to what is your end goal in 1 year, in 2, in 5, and in 8 over the line. Sell your product. Try to sell early on. So one of our biggest learnings is to actually interact with, for example, NHS procurement teams to really understand how they think about it, because we can build a great product that people love, users, patients love, but if it's not clear how they get the app reimbursed, and if the trusts are willing to pay for it and commission it, what's the point? So essentially, we spent time having these dialogues, which were extremely useful to really understand, okay, where is it, what we need to improve, how we need to position. So a common mistake that essentially, from my experience, don't give your product entirely for free. You can do different pilots and try to sell it to people and the different stakeholders, the commissioning groups, the GP, private clinics, the patient, to really understand where do you fit in the ecosystem and how your business model will be sustainable. I would like to finish off by also saying that team is everything. So please surround yourself by people who are the right fit, who believe in your vision, and who believe in the product and the problem that you are solving. And this takes time. It's very hard to find the right fit for your company in the beginning, especially when you are an early stage venture. So summary, you have to build a valuable product. And for that, find out what is the problem that you are solving. It's easier to say it than do it, believe me. Interact with a lot of people, ask a lot of questions. Feedback is absolutely essential. Get an early prototype. Don't be embarrassed. I think it was the CEO of LinkedIn who said, your MVP, your minimal viable product, you should be embarrassed to share that with others. It's true. But the earliest you compile this feedback, the better. And then obviously keep your patient always at the core of it, because we're doing this to improve the quality of the patient, but don't forget to find out ways to integrate with the healthcare ecosystem in this roadmap that we mentioned. So start very small, very focused, but move fast. Velocity is key in any startup, right? You have a runway. Health tech, that's the challenging part, right? If you spend 5 years trying to figure out something, I'm sorry, how are you gonna make that sustainable? So try to be very focused initially and break it down into different work packages, if that makes sense. And finally, get yourself surrounded by amazing team and collaborators. There's plenty of great people out there who are going to help. So I hope that this essentially gives a good overview of, the learnings we went through, what we are doing. We are still in this journey, and I would love to discuss more with you all now. Thank you.